Adam. Adam is a 51-year-old English teacher suffering from left total anterior circulation syndrome. He also has non-fluent aphasia. Patients suffering from non-affluent aphasia are often presented with difficulties with speech production. There can be problems in different parts of the speech production system, hence patient can present with articulation breakdown, phonemic breakdown, which is difficulties with sounds, and other problems. However, it is rare for patients to have just one of these problems, and most people will present with more than one problem. Features include hesitant, effortful speech, speech apraxia, stuttering, anomia, phonemic paraphasia, agrammatism. I've noted that patients with non-fluent aphasia are capable of singing words that they cannot speak. Thus, the use of melody and rhythm has long been recommended for improving aphasic patients' fluency, which is a music-based treatment called Melodic Intonation Therapy. It uses natural prosody to stimulate verbal expression. The general procedures for musical intonation therapy (MIT) are selecting high-probability words, phrases, and sentences, using pictures on environmental cues for each target utterances, intone each word, phrase, or sentence slowly and with constant voicing, maintain speech and stress variations of normal speech, tap client's left hand once for each intoned syllable, signal with your left hand when to listen and when to intone, and move to the earliest step if client fails a step. Now, let's take a look at how is MIT carried out in therapy sessions. Step 1. The SLP hums short phrases in a rhythmic sing-song tone. The patient tries to tap out the rhythm and stress patterns. Step 2. The patient repeats the hum phrases with help from the SLP. The patient repeats it. Then, the patient and the SLP hum in unison. Step 3. The SLP intones a sentence. Hello, hello. The patient repeats it. Hello, hello. 4. The therapist's participation is minimized and the patient begins to respond to questions using the rhythmic speech patterns learned previously. The SLP will ask, "Hello, Mr. Adam, what do you say?" And the patient replies, "Hello, hello." Step 5. More complex phrases and longer sentences are introduced. I want to eat. And the patient replies, I want to eat. Step 6. The patient transitions the constant melodic speech used to a variable speech that is used in normal conversation. Normal stress patterns, tempos, and rhythms of speech are practiced. So that is how Melodic Intonation Therapy (MIT) is carried out in therapy session. Hope you guys enjoyed the video.